How are you, Lily?
Good. How are you guys?
We are good.
Good, 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 good. All right, so I am Lillie Madden with Leadership Initiatives, and we're gonna see if we can start getting you feeling better today. What is the patient's full name?
Yes, Bilkis Abbas.
Perfect. And what is the age and gender?
She is 15 years old, female student.
Perfect. Okay, and so what about marital status or any
She,
children?
she is not married and has no children.
Okay, perfect. And then what about tribe or ethnic background or religion?
She is Hausa and practice Islam as religion.
Awesome, perfect. Okay, so what is the patient's main complaint? What is and some of the symptoms that come with that?
So she comes with fever, headache, and vomiting all of
Okay.
1 week.
Okay, over 1 week. So when did her symptoms start?
1 week ago.
1 week ago. Perfect. Okay, so can we kind of talk more about symptoms? What is kind of like the nature of the fever?
The fever is intermittent in nature.
Okay, intermittent, so it kind of comes and goes.
Yeah.
Perfect. Okay, and then I also wanted to ask some other questions like, where does the patient kind of like their environment? What is their environment like? Where do they live?
So of recent, there are collections of water around the house because it's a rainy season,
Okay.
which allows for growth of some bushes nearby.
Okay, perfect. And then what about like eating and drinking habits?
So of recent, she's afraid of eating because whenever she eats, she has vomiting.
Okay, she will vomit when she eats. Are there any constipation or diarrhea issues?
No constipation, no diarrhea.
Okay, so no gastrointestinal issues really?
No,
Okay,
not at
perfect.
all.
Okay. Did anybody in her family have any of the same issues?
No, she's the only one coming down with these symptoms.
Okay, perfect. Um, okay, and so are there any other symptoms that I should be aware of, like coughing, sneezing, having trouble
No,
breathing, anything like that? Okay, perfect.
no,
What about um, where was the patient when these symptoms started?
I didn't come again.
Where was the where has the patient like traveled anywhere, or was she
No,
just
it's
in
no,
her
it's
area?
travel.
Okay, perfect. Um, and then let's see. Has the patient been feeling any, mood swings or like depression or anxiety?
Not at all.
Okay, perfect. Okay, so I think that I'm gonna go ahead and diagnose this patient with malaria. And so
Yes.
what we can do for that is we can go ahead and get a blood test and a rapid test for malaria. And
Rapid
so
diagnostic test.
yes.
Excellent. We did it and it's positive.
Okay, it is positive. Perfect. So now that we know that it's positive, we can go ahead and finish with our treatments and stuff too. So I would say go ahead and we would start with ATC medications. Um,
ACT.
ACT, sorry. Go ahead and start with those for a little while, and then if there needs to be any supportive care like IV medications, therapy, or other supportive care kind of like that, we could integrate that later. And then for prevention, I would say just making sure that you have places in your area that have stuff like mosquito nets, things like making sure that you're wearing like bug spray and stuff like that for prevention. And What am I missing?
Long sleeves,
Yes, wearing
mosquito
like long
repellent.
sleeves, making sure that you're kind of fully covered when you're not wearing things like bug spray and stuff like that. Um, but that's my diagnosis and treatment
You
and
have done a
prevention.
very, you have done a very good job to this patient. You have exhausted all her problems, trying to
Perfect.
rule
Thank
out
you.
differential diagnosis.
Perfect.
Hopefully,
Thank
she
you
will
so
stick to
much.
your advice, treatment, and prevention strategy. You'll
Awesome.
be a good doctor in the future, hopefully.
Thank you so much. You guys have a
Hope
good
to
day.
see hope to see you in the tropics in Nigeria specifically.
Yes.
Wish
Thank
you all
you.
the best, Lily.
You
Thank
too.
you. She's
Thank
waving you.
you.